Drug combination therapy has emerged as a comprehensive treatment approach for diabetes. These combinations help control your diabetes better than either medication on its own. In this video, we will introduce a combination medication currently available in Europe, Xigduo. I'm Daisy, welcome to HeInfo channel. Xigduo is a diabetes medicine used, together with diet and exercise in adults with type 2 diabetes. It contains the active substances dapagliflozin and metformin. Xigduo is used on its own in patients whose disease is not controlled well enough with metformin alone. In combination with other diabetes medicines when these medicines together with metformin are not controlling the diabetes well enough. Xigduo can also be used to replace dapagliflozin and metformin taken as separate tablets. How is Xigduo used? Xigduo is available as tablets containing 5 mg of dapagliflozin with 850 mg of metformin and as 5 mg of dapagliflozin with 1000 mg of metformin. The recommended dose is 1 tablet taken twice a day with a meal. The strength should be chosen so that in total, patients receive 10 mg of dapagliflozin each day and the same, or almost the same, dose of metformin they were taking before starting Xigduo. When Xigduo is added to treatment with insulin or a medicine that helps the body to produce insulin, such as a sulfonylurea, the doctor may need to lower the dose of insulin or sulfonylurea to prevent hyperglycemia, low blood sugar levels. The medicine can only be obtained with a prescription. For further information about using Xigduo, see the package leaflet or contact your doctor or pharmacist. How does Xigduo work? Type 2 diabetes is a disease in which the pancreas does not make enough insulin to control the amount of glucose, sugar, in the blood or when the body cannot use insulin effectively. This leads to high levels of glucose in the blood. Xigduo contains 2 different active substances, which work in different ways. Dapagliflozin blocks the action of a protein in the kidneys called sodium glucose cotransporter 2, SGLT2. As blood is filtered by the kidneys, SGLT2 stops glucose in the bloodstream from being passed out into the urine. By blocking the action of SGLT2, dapagliflozin causes the kidneys to pass out more glucose in the urine, thereby reducing the levels of glucose in the blood. Dapagliflozin has been authorized in the European Union, EU, as Forxiga since 2012. Metformin works mainly by reducing glucose production and reducing its absorption from the gut. It has been available in the EU since the 1950s. As a result of the action of both active substances, the blood glucose is reduced and this helps to control type 2 diabetes. What are the risks associated with Xigduo? The most common side effects with Xigduo, which may affect more than 1 in 10 people, are hyperglycemia, when used together with insulin or a sulfonylurea, and gastrointestinal symptoms affecting the stomach and gut. For the full list of side effects of Xigduo, see the package leaflet. Xigduo must not be used in patients with any form of acute metabolic acidosis, buildup of acid in the blood, such as diabetic ketoacidosis, high blood levels of acids called ketones, or lactic acidosis, buildup of lactic acid in the body. Patients with diabetic precoma, a dangerous condition that can occur in diabetes. Patients with reduced liver function. Patients with severe reduction in kidney function or with conditions that could alter kidney function, such as dehydration, severe infection, or shock. Patients with diseases that could cause tissue hypoxia, reduced levels of oxygen in body tissues, such as heart or lung failure, the heart and lungs not working as well as they should, recent heart attack or shock. Patients who are intoxicated with alcohol, drunkenness, or who regularly drink excessive amounts of alcohol. For the full list of restrictions, see the package leaflet. That's some basic information we want to provide to you. Thanks for listening. Do not forget to like, share and subscribe for HeInfo channel.